All right, well, good morning. Just wanted to welcome everybody to our webinar this morning. We're very excited to have you join us. On behalf of the Northwest Mental Health Technology Transfer Center, welcome to today's webinar topic, Forensic Mental Health Practice and Training, Expanding Programming in Washington. This is actually the first webinar in our three-part series on forensic mental health. We're very grateful so many of you could join us, and I know some more folks will keep logging in as I do this intro, which is fine. We look forward to sharing information with you, guidance, and having an exchange of information with you. My name is Christina Clayton. I'm one of the co-directors of the Northwest MHTTC. First, a little introduction into what the MHTTC is. The MHTTC network is a nationwide network that is supported by the Substance Abuse and Mental Health Services Administration. And our purpose is including disseminating and implementing evidence-based practices for mental health issues into the workforce. This network started near the end of 2018, so it's relatively new. And the goals are to include supporting mental health evidence-based practices, heightening the awareness, knowledge, and skills of the workforce, fostering regional and national alliances, and providing and connecting you to free training and technical assistance like today. Now a little bit about our Northwest MHTTC. We are based at the University of Washington in the Department of Psychiatry and Behavioral Sciences, and we specifically provide training and TA to Region 10, which includes Alaska, Idaho, Oregon, and Washington. If anyone hears from Alaska, we know this is not the right size. It's much bigger in comparison, but we always like to give a shout out to our Alaska people. Our area of focus for our network is evidence-based practices for serious mental health issues, such as psychosis. However, we provide training on a variety of topics, including integrated care, suicide prevention, diversity and equity issues, school mental health, peer support, trauma-informed approaches, and others. And our target workforce basically is very inclusive. Anyone who's doing work with individuals who are at risk or developing serious mental health issues. How do we fulfill our mission? We do live events like this that we record and post. We have virtual learning communities, free self-paced online courses, newsletters, and a resource library and connection to other training and events. So if you want to know more, please go to our website. You can sign up for our newsletter and hear things right as they get developed. Just like to do a brief land acknowledgement. We know we're all virtual right now, but for us, the Northwest MHTTC honors the many cultures and lands across our region in Alaska, Idaho, Oregon, and Washington, and hundreds of tribes and tribal folks within our region. So we want to acknowledge that the Northwest MHTTC based in Seattle sits on the traditional land of the Duwamish and Coast Salish peoples, past and present. We really honor with gratitude the land itself and the people who have stewarded this land throughout the generations. Little bit about language. We just want to be mindful of using language that promotes recovery and is person-centered and doesn't use labels in a, disrespectful way. We just want to foster, respect, human dignity, and hope, and we're sure that will be present today. A little bit of logistics regarding the session today. So as you noted, we are recording this. This will be edited and put up on our website, and you'll be notified when that is ready, as well as the slides. So give us a couple weeks, we'll get that up on our website and we'll notify you by email. And you are muted, video off, just because it's a large audience and there's not really interaction in that way. And we are able to offer certificates of attendance, not formal CEUs, but you'll get an email separately about that if you choose to go ahead and pursue that. You can usually turn those in for your various licensing boards. Chat is open, but obviously Dr. Piel will be speaking most of the time and we'll be doing questions via the Q&A box. But if you have any technical issues during the course of the webinar, please chat and our staff here will assist. And then QA. So we will queue these up for the end of the presentation. If you have any questions at any time, go ahead and type it into the Q&A box. If you put questions in the chat box, I don't know why, but Zoom doesn't let us copy and paste those in there. So we'll have to ask you to do that. And then we will moderate and share those with the presenter at the end. And unless it's a short question, that's something we can answer for you. Lastly, your feedback is really crucial to our work. So we'd appreciate your response to a very short survey that takes just a few minutes after the session. Our team will share that link by the chat today. You'll get an email reminder via Zoom. We're required by SAMHSA to conduct the survey, but it's all confidential. Really appreciate your feedback. And Dr. Piel and all our presenters really appreciate the feedback that you share. It's all aggregated, and it just lets us know how did it land and what might we want to do differently or the same in the future. Just a disclaimer, SAMHSA sponsors this work, but does not have any official position on this content. So off to the good stuff. So Jennifer Piel, Dr. Jennifer Piel is a clinical and forensic psychiatrist. She is an associate professor at the Department of Psychiatry and Behavioral Sciences here at the University of Washington and the director of the university's Center for Mental Health Policy and the Law. She received the 2017 American Medical Association Foundation Excellence in Medicine Leadership Award, in part for her advocacy for persons with mental illness who have criminal justice involvement. She is the Legal Digest editor for the Journal of the Academy of Psychiatry and the Law, and she specializes in psycholegal assessment, research, and education. So I'm going to turn it over to Dr. Piel. Very excited to have you here and let you take it away.
Thank you so much for the wonderful introduction. I'm going to go ahead and get my slides queued up here. Okay. Well, I am delighted to be presenting today on a topic that is very important to me, forensic mental health and training in this area. I'm going to share with you some information about a new university-sponsored center, the Center for Mental Health Policy and the Law. And this center aims to advance education, research, and service at the intersection of behavioral health and the law. And I will focus the latter part of this talk on some aspects of training in forensic mental health. As was mentioned, this is the first of a three-part webinar series related to topics in mental health and the law. You will learn in the course of today's talk that the UW Center for Mental Health Policy and the Law has three main arms. Although programming in these arms overlap, the three talks in this webinar series will each discuss an aspect that relates to one arm of the center. Today, I'll focus on mental health training and also just a general overview of forensic mental health. Next week, I'll be joined by Dr. Sarah Walker, and we'll be discussing translating research and clinical knowledge into policymaking. And then in 2 weeks' time, on April 22nd, Dr. Sarah Kopelovich will speak on aspects of treatment in secure settings, like correctional and forensic hospital settings. These are the objectives for today: to become more familiar with the breadth and unique roles of forensic mental health. I'm going to share a little bit about the Center for Mental Health Policy and the Law, and then I hope you have a sense to appreciate the role for increased training and education in forensic mental health. So first, what is forensic mental health? Well, for some of you, your understanding of forensic mental health likely comes from the media. And this could be fictional representations of forensic professionals, such as Dr. Hannibal Lecter, who is a cannibalistic serial killer, but also a respected forensic psychiatrist who consults with the FBI to assist them with finding other serial killers. For others of you, you may know of forensic psychiatry or forensic mental health practitioners through high-profile legal cases that are depicted in the media. Here is Andrea Yates. She was found not guilty by reason of insanity for drowning her 5 children in her bathtub. She had a history of severe postpartum depression and is now in a state psychiatric hospital. The man shown here is Mr. James Holmes, and this is another example that made media headlines. Although he attempted a mental health defense, he was found guilty of killing 12 people and injuring 70 in a shooting at a Colorado movie theater in 2012. Now, I bring up these cases because the notion of the hired gun and the battle of the experts is what is often brought out in popular press and what some people think of when they think of the forensic mental health practitioner. But what is shown in the media is often a narrow and sometimes inaccurate view of forensic mental health. It's important to know that forensic psychiatry and forensic mental health more globally is more than consultation or expert testimony. And although that is a very important component to be able to educate and advise the courts, there's actually a lot more to forensic mental health than that. And I hope to make that clear today. Forensic psychiatry and forensic mental health in general is a specialty that deals with people who are involved in legal matters. And this is the definition of forensic psychiatry from the American Academy of Psychiatry and the Law. This definition reads, forensic psychiatry is a subspecialty in which scientific and clinical expertise is applied in legal contexts involving civil, criminal, corrections, regulatory, or legislative matters, and its specialized clinical and consultation in areas such as risk assessment or employment. Now, this is the definition for forensic psychiatry, but the definition for forensic psychology is similar. And forensics, of course, crosses many other disciplines, including nursing and social work. We often conceptualize forensic mental health by thinking of three primary divisions. There is the criminal forensic division, civil forensics, and then the legal regulation of psychiatry, or the legal regulation of mental health practice and delivery. And I'm going to give you some general examples for each of these categories. Here are some examples related to criminal legal matters that may call for mental health expertise. This list is in no way exhaustive. So, competence to stand trial, in other words, is someone fit based on their knowledge and current mental capacities to go forward in their legal case and face trial. Criminal responsibility. This is also known as not guilty by reason of insanity or insanity. And this relates to one's mental state at the time of committing a criminal act. Sentencing considerations, whether there are mitigating factors, particularly psychological factors, that could weigh in on the ultimate sentence a person receives. Assessment of violence risk, treatment in corrections and forensic units, diversion, so diversion from the criminal justice system altogether, and then the role of race, disability, and bias in the criminal justice system. Listed here are just a few examples of civil legal matters that may call for mental health expertise. The assessment of disability, so whether someone meets the legal definition of a particular disability, such as the Americans with Disabilities Act. Civil capacities, like the capacity to make a will or to enter a contract. Psychiatric malpractice, guardianship, fitness for duty, so whether someone has a mental condition that renders them currently unable to work in a particular employment position. An assessment of whether someone sustained psychological harm from a claimed injury event. These events could include sexual harassment, gender discrimination, or other types of personal injury. An additional area of forensic mental health is the legal regulation of psychiatry, or the legal regulation of mental health service and delivery. Some examples here include the legal and ethical rules and exceptions to confidentiality, the mental health clinician's duty to protect third parties from the violent acts of their patients, civil commitment or involuntary commitment and treatment, substantive and procedural issues around treatment refusal and involuntary treatment, informed consent, and professional licensure standards and disciplinary procedures for mental health professionals. So let's turn now to talking about the newly formed UW Center for Mental Health Policy and the Law. And this center was just formally recognized last summer around July of 2020. The impetus for the center started actually several years ago. The legislature directed the University of Washington, to conduct an analysis and develop a plan to create high-quality forensic teaching services at Western State Hospital. And I was fortunate to be among a skilled and knowledgeable team of educators and forensically trained clinicians in our department who worked on this proposal. We recognize that Western State Hospital and UW formally co-sponsored forensic psychiatry fellowship spots, but this is no longer in existence, and there is no current forensic psychiatry fellowship in the state. There is a forensic psychology fellowship that is hosted through Western State Hospital, but is not a current co-sponsored program with any academic center. In the course of our analysis and plans, we looked at ways to strengthen forensic training and services broadly in our state. At the same time that we were researching and preparing a proposal for teaching services at Western State Hospital, there were things going on across the state that signaled a need for more forensic training and services. Washington, like most states, has seen a rising volume of persons with mental illness involved in the criminal justice system. Governor Inslee announced plans to create forensic centers of excellence at one or more of our state hospitals. And forensic facilities have many of the patients most in need of high quality psychiatric services. The governor's plan included increasing the workforce of mental health professionals in the state. And there were also some legal cases that have drawn attention from the mental health community and the legislature, some cases that really illustrate the intersection between mental health and the law. And I won't go into the details of those here today. With all of that, we hoped to garner interest and support to create a center for mental health policy and the law. And we initially identified this as our mission: to advance empirically supported assessment and intervention practices, to assist courts in making informed decisions by providing evaluation and consultation services, enhance law and policy by educating policymakers on behavioral health and psycholegal issues. And a number of them are listed here, such as criminal responsibility, various competencies, treatment in secure settings, and juvenile justice issues. And the topic of today, to train and educate the next generation of scholars and practitioners in forensic mental health, in addition to others that may interact with the criminal justice system. So here's a schematic, if you will, of the Center for Mental Health Policy and the Law. We envision that the center will develop over time to really become a leader in shaping care delivery and public health by working at the intersection of mental health and the law. We hope that university faculty and staff will work together with a number of community partners and other affiliates to really advance the three arms of the center. And those arms are education and training, policy and research, and service. And we know that as an academic hub, we can't do this work alone. Certainly, partners and affiliates really are central to this design and the mission of the center. I'm going to just share briefly with you a little bit about the three arms. First, the education and training arm. Now, this is an important arm in part because this is really the arm, I think, that will lead towards workforce development in forensic mental health. The center faculty are currently working on ways to create a forensic fellowship in psychiatry and also other dedicated forensic training opportunities. I've listed here just some things that the core and affiliate faculty associated with the center have already accomplished. Many of us have worked on scholarship in forensic education. We had a great opportunity to look at existing programs across the country when we were preparing our analysis related to Western State Hospital. And many of our core faculty have really become leaders in understanding the requirements and also best practices in teaching forensic scholarship. We offer rotations in forensic psychiatry for general psychiatry residents, and we hope to continue to do that and bolster them as we gain more resources in the future. We provide didactics for a number of different types of healthcare trainees, from nurse practitioners to social workers to psychology trainees and psychiatry trainees, among others. During spring quarter at the University of Washington each year, I lead with Dr. Goldenberg a course for graduate students and law students, specifically in psychiatry and the law. This lays a foundation of topics related to forensic mental health And it also enables the students who participate to individually tailor the class to a particular interest they have. They each develop research skills or policy skills in a particular area and work on that throughout the course of the class. Many of our faculty give lectures to community partners and also members of the legal community. We have a growing forensic library, and we also sponsor ground rounds lectures on forensic mental health topics. The next one will be on April the 23rd through the University of Washington Department of Psychiatry Grand Round Series. The next arm of the center is the research and policy arm. Now, this center aims to take an academic approach to research related to forensic mental health. Research will focus on a number of areas based on the expertise of affiliate faculty and hopefully also the needs of the state. This is some of the examples of work we've done to date. Our core faculty has put out an outreach survey trying to identify core topics of concern amongst members of the community here in Washington and more broadly in terms of the most pressing needs in the area of forensic mental health. Many of our faculty have very specific areas of expertise, and they continue to publish and give talks on those areas. We've been trying to emphasize and garner interest in trainees getting more exposure to forensic research and scholarship and helping them with their publications. Some of us have served as expert matter consultants on reports to the legislature on medical legal or psycholegal topics. I've participated in writing a number of amicus briefs and also op-eds in effort to promote forensic mental health topics to a broader community audience. Here are some examples of recent research and policy work from faculty and affiliate faculty with the center. One of our affiliate faculty has been working on the association between different types of criminal justice involvement and suicide attempts. Really interesting work looking at recent arrest and the increased rate of suicidal thinking and behavior in that group. Some of us have looked at juvenile sentencing policies, trying to apply the various legal standards around this area and inform policymakers and others about brain development and how they relate to those legal parameters. I've worked on psychological implications of solitary confinement and behavioral health implications of inmate release during COVID-19. Translating research to policy. This is the focus of the next webinar next week. And then one of our scholars has been working on enhancing access to evidence-based psychotherapies for psychosis in forensic settings. And of course, that will be the topic of the webinar in 2 weeks' time. And the final arm of the UW Center for Mental Health Policy and the Law is the service arm. Under the service arm, the center plans to develop clinical services in the form of a specialized forensic mental health assessment clinic, really hoping to garner interest and give some practical experience for trainees in this area. And we want to be able to provide specialized assessments for the courts and the workplace. We also hope that affiliate faculty are in positions to provide direct clinical care to justice-involved persons. And we hope to help implement evidence-based practices, particularly clinical practices in forensic and secure settings. So with that, let's turn a little bit more towards the training arm, the education and training arm. As you learned, one arm of the center is focused on education and training related to forensic mental health. So I want to share with you more about why this is so important. Forensic psychiatry and psychology are recognized subspecialties in mental health. And we know from research and also our review of existing programs that the demand for training in this area is very high. But we currently have very limited resources for formal training, such as fellowship training in this state. As I mentioned previously, Washington currently does not have any forensic psychiatry fellowship. And until recently, the forensic psychology fellowship through Western State Hospital trained only one psychologist per year. So, unfortunately, people who are interested in really developing subspecialty skills in this area commonly leave our state to get that training, and not uncommonly, they don't return. Because forensics is so heavily invested in the legal standards, and also just because people gain relationships and get access to their jobs and employments while they're in training, it's very difficult then to transition back to another state, like returning to Washington, if they do in fact leave to get specific forensic training. But this link is very important to developing the workforce that has the skills and aptitude to continue to work with justice involved individuals. So you've learned already that forensic mental health is a very wide discipline. And I've shared for you some of the types of topics that are covered within the breadth of forensic mental health. But I'm now going to provide some examples related to how dedicated forensic mental health training advances programming and care for persons with mental illness who have specific criminal justice involvement. And let's start by taking or just looking at the numbers. So there are currently more than 2.3 million incarcerated persons in US prisons and jails. And in fact, this number does not include people who are incarcerated in US territories, military facilities, immigration and custom facilities, or even juvenile facilities. There are another 4.5 million people who are under community control, like probation and parole. Now, there are a number of reasons for these large numbers, but some of the reasons put forth are longer criminal sentences. Some jurisdictions have three-strike laws, and it's very difficult in many jurisdictions for people to attain and then maintain parole. For example, sometimes even minor infractions while someone is on parole may land them back in a correctional facility. Okay. Given the numbers of people in corrections, it's not surprising then that there is a significant number of people with mental illness who are in correctional facilities or otherwise involved in the criminal justice system. In fact, people with serious mental illness are overrepresented in the criminal justice system. State psychiatric hospitals have dwindled in past decades, and treatment has shifted from long stay state hospitals to short stay and acute management. With this, the frequency of persons with serious mental illness who have involvement with the criminal justice system has increased. Serious mental illness has become so prevalent in our correctional facilities that jails and prisons are now commonly called the new asylum. Studies have consistently indicated that roughly 20% of inmates in jails and 15% of inmates in state prisons have a serious mental illness. And beyond that, half of US inmates have at least one mental health condition. Now, some people will develop mental health conditions while they are detained or while they're incarcerated. Others have conditions that may have contributed to their criminal justice involvement in the first place. It's worth noting that even persons with serious mental illness may elect not to use, or they may not qualify for a mental health defense related to their criminal act. Now, there are a lot of dedicated and skilled healthcare providers that work in secure settings, like these forensic settings here. But these environments can really challenge care delivery. And although there are a lot of commonalities across these secure settings, there are some important differences that affect care delivery. So looking first at jails. For those of you who don't know, jails typically are short-term, if you will, stays. These are people who are awaiting adjudication or pretrial, or those who have been sentenced to less than 1 year. And because of that, there is common rapid turnover of persons in jails, which really can challenge the ability to provide care. And so for that reason, care is often focused on an initial assessment. You can imagine, for example, someone who may need medication management in a jail setting. Because particularly at the pretrial stage, you don't know if the person's going to bail out the next day or if they are going to have their case dismissed. It can be really difficult in selecting medications that would be appropriate. Some medications require lab monitoring and observation. And so, if you don't know if the person will be there the next day or short term to do that, or if you don't know if they are going to have easy access to care outside of the detention facility, that can really impact the choice of medications that you give the person. In jail settings, it's not uncommon for many to receive their first formal psychiatric assessment. Now, this differs somewhat from prison sentences. Prisons typically are for people who have been convicted of a felony. And with that, that means their sentence is for 1 year or more. Because people in prison are likely to be there for a longer term, there are more opportunities typically in prison to engage in longer term treatment. And we see more therapy services typically provided in a prison setting. A really important component of the care and treatment delivered in prison is to think even very early on about post release and transition planning, trying to help people get engaged in resources that they'll be able to utilize once they transition out of the facility. And then state hospitals. You may know that more than 50% of hospital beds in most states, including here in Washington, are occupied by forensic patients. That has not always been the case, but we've seen a steady increase in the number of beds being utilized for forensic patients rather than civil commitment over recent years. In these state hospitals, the length of stay is variable. And commonly on the forensic setting, people are there for evaluation of their competence to stand trial and for restoration. And then more long term, people may be there for treatment and management after being found not guilty by reason of insanity. So, given the high numbers of persons with mental illness who are involved in the criminal justice system, scholars have said that we are having an epidemic of mental health concerns in corrections. And there are a lot of factors that contribute to the numbers of persons with mental illness who are involved in the criminal justice system, including legal, social, and political factors. We've already touched on a couple, such as lengths of stay for sentences and the difficulty to maintain parole. There's a concept called deinstitutionalization, and that's really moving persons from long-term hospital facilities to community resources. And also trans institutionalization, the notion that persons who had been hospitalized in long-term facilities have now moved into correctional facilities. These are common terms used within the forensic mental health sphere. Historically, the legal system has had limited capacity to identify mental illness versus lawbreakers. And this is another area where forensic mental health specialties and practitioners can really play a role. Specialized training in the assessments, such as diminished capacity, insanity, can really help with this distinction. The violence criteria for involuntary commitment in most states makes it very difficult to commit most people against their will. And that's because the criteria heavily focus on dangerousness in the immediate or acute setting. And for folks who don't meet that criteria or are not so gravely disabled that they can't care for their basic needs, getting them hospitalized can be very difficult. And because of that, that's one of the reasons why we see more turnover from community resources into correctional facilities. Really, there's this lack of care, continuity, both kind of in the acute setting, but also lack of continuity following release. It can be particularly challenging for individuals who have been in a correctional facility for a while to then try to navigate how to access care, where to go, particularly if they're having active symptoms of their mental illness, compounded by all the other stressors they're trying to deal with, right? Following up with their parole officer, perhaps. They may be looking for housing. They may have conditions that require them to look for employment. It can all be overwhelming. And so this leads to the concept that we often hear about, the revolving prison door, this concept of really going from the acute phase, being picked up by someone in law enforcement, going back to a correctional facility, being released, not having access to resources, and that system revolving again and again. Now, you may appreciate from our discussion already that persons in forensic settings are often the most in need of high quality services. And correctional facilities have a constitutional duty to provide necessary health services. That includes mental health services. So I've listed here the landmark case of Estelle v. Gamble. And this essentially establishes a constitutional floor for individuals who are working in healthcare settings, in correctional settings. Not only are there typical medical malpractice settings that you need to abide by, but there's also constitutional requirements. And if you fail to adhere to those standards, you could be subject to Eighth Amendment violations. These laws have largely been applied to mental health in addition to physical health needs in correctional settings. Now, for clinicians who work in this area, many of the things that they use in community practice will be relevant in a correctional facility. But there are some things that you may also want to pay particular additional attention to. In correctional settings, we often see a high degree of comorbidity of mental health, substance use, and physical health disorders. In the jail setting in particular, where there's more turnover, we see a high rate of intoxication and withdrawal that needs to be taken into account. You can imagine in all of these forensic settings, there can be adjustment reactions for persons involved. This can be a particularly stressful and difficult time in their lives. For some of these settings, the medication formularies are quite limited. Now, we're lucky here in the Seattle area anyway that the formularies at our local jails are actually relatively robust. But I can assure you that that is not the case in some correctional facilities across the country. Many individuals who are experiencing criminal justice involvement also have prevalence of trauma. This could be early childhood trauma, neglect, sexual trauma, military trauma, and all of that can really affect their presentation and how they adapt in correctional settings. And in fact, many individuals, once they are detained, have fear and sometimes actually experience victimization. This can be particularly true for persons with mental health conditions. And unfortunately, there are some predators that sometimes are in correctional facilities who will look for individuals with mental illness who may be more vulnerable. Hunger strikes are some things that happen in correctional facilities that the health clinicians need to be aware of. Suicide, of course, something to be very attentive to, and transition planning, really important as it can be so difficult for people to access care if they don't have good plans in place before they leave. So there are a lot of unique challenges for forensic delivery of care. Corrections typically is based on rehabilitation, but certainly we know that there are strong influences of punishment and retribution. The environment in correctional facilities is not the same as that, for example, in a psychiatric hospital. It's really not a therapeutic environment. Individuals there need to follow by the rules, and there could be a particular prison culture. It's not uncommon for individuals who are experiencing symptoms of their mental health, of their mental illness, to display behaviors that correctional officers may see as disruptive. And although they aren't intending to break the rules, they may inadvertently be identified as breaking the rules, which can lead to more punishment and sometimes even being placed in things like solitary confinement. The custody side and the healthcare side in correctional facilities usually is quite separate. They can be complementary, but sometimes conflictual. So the custody side may have information about a whole host of different aspects of the culture there in the correctional facility, who else is there, has a real role in trying to keep the facility safe. But you as a clinician might be looking at one individual and thinking that their mental health condition would better be served in one particular area, for example, of the correctional facility. Sometimes those are in alignment and sometimes not. Dual roles. So if you're a healthcare provider working in a correctional facility, you have the standard clinician patient responsibilities. And oftentimes you really are serving in that advocate role for your patient. But besides that, you have a dual role in that you also have a lot of duties towards the correctional facility itself. Safety, for example, is paramount in these facilities. And so sometimes there are challenges and ethical situations that come up because you're in this dual role. And then, like other settings, there's a risk of lawsuits and complaints. Besides the standard malpractice lawsuits, there could be also those constitutional suits for violations of Eighth Amendment rights. But there is huge demand for mental health clinicians who have the aptitude and training in this space. And compensation in forensic facilities is usually competitive. Those with specialty training are often leaders in these facilities. So, really helpful to have a broader lens when you're working in this space. With understanding of clinical care, research, and legal principles, individuals with specific training in forensic mental health can really advocate for persons in the criminal justice system. These include things like improved access to care, improved quality of care delivery, safety of staff, and the importance to recognize racial and other disparities that influence interactions with the criminal justice system. We're at the center anyway, really trying to focus on increasing educational opportunities, even for individuals who are relatively early on in their health careers. And studies have shown that increasing educational opportunities for medical students and mental health trainees to forensic settings has a wide variety of benefits, some of which are actually quite long-standing. Some of these include reducing personal bias, particularly bias against persons who are in the criminal justice system. It helps the trainees establish increased awareness of societal challenges such as medical comorbidities, economic disability, interpersonal issues with trauma history, advancing their comfort level in working in this population, and beyond just comfort, but giving them knowledge and competence in caring for justice involved populations. It helps trainees explore personal beliefs about social justice issues. And it can really foster an interest, at least for some, in getting specialty training in forensics, really going beyond an introductory level to getting more focused training like the fellowships that we've been talking about. Besides the healthcare trainee, increased training also has benefits to those who have direct criminal justice involvement, the patient, an evaluee, so not for treatment purposes, but perhaps if you're evaluating someone for a criminal defense, and the family. Now, continuing education and training opportunities can lead to increased professional satisfaction and competence, and that can lead towards workforce retention. So important that we don't just stop at a trainee level, but that we have avenues for ongoing training and support for clinicians in practice. And so that brings me back to the center, the UW Center for Mental Health Policy and the Law. Our center, the training and education arm, really hopes to identify and promote practices that will support a wide variety of training needs. So for individuals at the clinician in training stage, we already have some didactics through the University of Washington. We certainly hope to continue to expand that and really hone in on skills that are important for the everyday clinical practitioner. We have dedicated rotations that deal with forensic mental health topics, but we're hoping to expand these as well and provide more experiential learning experiences for clinicians in training. We hope some will develop a keen interest on getting more advanced training in forensic mental health. And so our center currently is really working hard to try to get a foundation and proposal in place for a forensic psychiatry fellowship and maybe other specialty fellowships related to forensic mental health. These would, of course, make the person eligible for forensic board certification. Beyond the trainee level, really important that we have a robust faculty that is trained in this area and that can support ongoing training. So we want to create a culture that's supportive of training and scholarship in this area and collaborative across disciplines and sites. And then working to promote ongoing training and education for individuals in the community. That includes not only mental health professionals who may be working in this space, but also others like first responders or the legal community that could benefit as well from more knowledge in this area. So we'd like to invite you to also participate in our efforts to promote forensic mental health education and training in Washington and maybe beyond. If you have an interest in this space, please identify yourselves. Feel free to join our network of academics and stakeholders so that we can better learn from you and that we can stay in contact with you. Mentorship. If you are interested in being a mentor or a mentee, particularly if you already work in a forensic mental health space, let us know. We are trying to work on some ways to develop more formal mentorship programs. Clinical sites. So that education and training arm for clinicians and training is very important, but it can be difficult to find training sites. So if you have a site that you may think would be great for future resident or other trainee, please let us know. In addition to teaching, if you want to give a lecture or if you know someone who would be skilled at giving a lecture on a forensic mental health topic, let us know. And along that lines, if there are topics for future presentations that you are interested in, please reach out to us. We certainly take that into consideration and try to match our current needs with the skills we have of our developing workforce and academics. Okay, so please feel free to reach out to me. I've identified my contact information here and also the email for our Center for Mental Health Policy and the Law. We really do hope to hear from you if you have questions about forensic mental health or if you'd like to get involved in our center. So I'm going to go ahead and stop the screen share. Great. Okay.
All right. Well, thank you so much, Dr. Peel. That was a lot of information. So I've just put another call out for if people have specific questions. So we don't have any open questions at this time, but if anyone has some topics they want to put in the Q&A, that would be helpful. I guess a question for you based on what you shared. And again, just a reminder for anyone that joined late, we'll get these slides up and the recording and have folks be able to attend that. When you think about what the needs are, what are the most common, we didn't do the poll today where we asked who is in the audience, but my sense is guessing that there are a lot of direct care providers, case managers, maybe people not working directly in forensics, but what are some of the top things that you think about that folks would be helpful for them to understand about this context of forensic mental health? I think about folks working on involuntary treatment procedures or understanding when their person has court. In your experience, when you talk to folks doing direct care out there, what are the most common things that you either find that are myths out there or things that are helpful to clarify, just to sort of open the door a little bit to this topic?
Sure. Yeah. It can be really challenging if you are suddenly faced with medical legal topics that you are not yet familiar with. And it can be kind of scary. So we're hoping over time that the center can be a place you can reach out to us for some basic answers. Really important that you recognize people who are involved with the criminal justice system, for example, want to be treated, I think, just like you said at the very beginning of the talk, with respect, right? Unfortunately, sometimes there are negative attitudes towards individuals who are in this space, and sometimes it translates into their healthcare delivery. But trying to get more exposure to working with this population, trying to work to meet their needs is really important. Uh, Oftentimes, this population has a host of different needs that really maybe extend beyond what you as a clinician can do, but really important to take into account when you're providing care. So, housing for this population can be really challenging. Imagine someone who has both a diagnosis of a mental health condition and has a history of criminal justice involvement. It can be pretty hard for them to find and sustain housing. Employment, similarly, right? Some of them, particularly if they've been incarcerated for lengthy times, relationships with family members have really deteriorated. Or even if they were relatively good while they were detained, trying to transition back, it can be a really difficult and stressful time. So just kind of appreciating these other things that they're going through can be really valuable in those clinical interactions.
Great. Well, we have some questions, as I knew we would. So I'll just start with the first one. Have you factored in peer support into your program? So that would be an interesting question. Thought I'd field that
So
to you.
peer support is certainly a big topic. And as you may know, the state is really emphasizing things like forensic navigators, trying to help people navigate this forensic system. As a center, we don't have the bandwidth at this point to educate or actually provide peer support, but we are looking at ways that we can evaluate some of these programs and help support them as they develop in the future, because certainly they can be huge, not only for an individual who is facing this unusual and difficult forensic setting, but for family members who often feel left out and just don't have the resources or know where to go to get information.
Mhm. Well, that's actually, it's not in the Q&A, but I was just waiting for them to put it in. But someone did ask in the chat, um, where can family members learn about applying for involuntary commitment, and are there resources to help families get help for folks with serious mental health issues that can no longer live at home? I'll just say, that's just in my experience, completely dependent on where you live. So I know what I'm familiar with in Seattle is the King County sort of behavioral health division. There are a lot of resources on how you can pursue that, but that's county specific. And so I don't know if you have other more broad resources that people can start, or is it always their county or city, or how do folks you know learn about applying for involuntary commitment?
So it very much varies by state. In Washington state, we do have a procedure for family members to petition the court directly to have their loved one committed. That's called Joel's Law. Some states do not have that. But if you have a loved one that has been perhaps evaluated previously by our designated crisis responders or previously evaluated for civil commitment and was found not to meet criteria at that time, but you have significant concerns and feel like they likely need that, as a family member in Washington, there is this additional legal procedure that you could use. And you would reach out to the court system to get the forms to fill that out and advance that.
Great. I just quickly looked that up. Joel's Law, I think is what you said. So I'm going to put that in the chat just in case people, it's just a NAMI website, but they tend to have pretty good informative
And
stuff in
Joel's is
Washington about,
another place,
yeah.
because they are a national organization. They keep their feelers out for things that are going on across the
Mhm.
country, and can be a good resource for family members.
Yeah, no, that's great. So another question, great overview of the criminal arm. Are you able to speak any further about the civil arm? And what is the role of telepractice in forensic settings?
Yeah, so a lot of questions there. The civil arm
Yeah.
is very important, and it may be where a lot of you have most of your experience, right? Civil commitment is a particularly large section of that civil arm. So, as clinicians, very important that you know the standard for civil commitment and know if that standard is changing. So, in Washington State, for example, our civil commitment laws got changed last year in the legislative cycle. And many changes went into effect last June, June of 2020. And one of the most significant changes went into effect this January, January 2021. But unfortunately, a lot of mental health clinicians were not aware of these changes. And so, very important that you find resources in your community to stay abreast of these changes. Hopefully, organizations like professional organizations might be attuned to that. Hospital associations, if you're affiliated with an academic center, sometimes that can pass on information. But knowing those changes in legal standards is part of your professional responsibility, but it can be really hard to stay up on them. So trying to figure out ways to do so is important.
Yeah, can you just bullet point, are there a couple of key things that if anyone's on the line from Washington that they should think about or know? Because sometimes those sort of roll out in other places too. But are there key takeaways that anyone on the call from Washington should know?
Well, in terms of the civil commitment law, the
Mhm.
biggest change that just recently went into effect is that instead of a 3-day initial emergency detention period, that is now extended to 120 hours. So essentially a 5-day period. So that makes a lot of difference for kind of how much care you can provide someone while they are emergently detained. but also can have really significant consequences on the person who is detained, right? 5 days that doesn't usually include weekends. That's a long time, perhaps, to be out of work, to be, not having contact with your regular responsibilities. So, really important that clinicians are aware of that if they are working in a hospital setting for involuntary treatment, but also outpatient. If you are referring someone for civil commitment, knowing that those initial detention periods have lengthened is really important to know.
Yeah, great. Well, thank you. Couple more questions. Someone who's working as a case manager, and they have been trying to find bachelor's level forensic behavioral health courses, but haven't been successful yet. Do you have any idea where, a non doctoral level yet person might find courses in this realm? I've tended to see those in some of the local, formerly known as community colleges. Sometimes there's specialties there or certificate programs. But if folks aren't quite yet in the doctoral level program and postdoc kind of stuff, where might those folks look for training?
That's a very good question. Usually at the bachelor's level, there's just limited resources. So typically the courses are an introductory course on, usually it's psychology in the law. So look for a course like that. It might be under not only the psychology department, but it could actually fall under the criminal justice department. So look for that. In the past, I know locally, Seattle University has had some courses in that. Antioch University has had some courses in that. And besides kind of academic paths, sometimes you can get community trainings. So, for example, our center, we sometimes have just general trainings that anyone can attend. May not provide you with a certificate avenue, but exposes you to some of the areas of forensic mental health.
Right. Um, And so, kind of along those lines, since you are thinking about training those graduate students, will you also have opportunities for undergraduates or research assistants? I know that the center just got started really, and it takes a minute to get rolling, but I assume you might have a cadre of people working among you. But I know it's also very difficult when you're probably spread across a few grants and a lot of a lot of staff and different things. So, yeah.
Absolutely. Yeah. We're still at kind of an infancy stage. We have a very small core faculty at this point, growing affiliate faculty. But yes, so the research arm is very important. And certainly we want to encourage young researchers and individuals who want to get some exposure to research in forensic mental health to work with us, or if we can help them in some way, we would like to do that. And in fact, over time, we are hoping to develop a specific fellowship in forensic mental health research. And so we're looking at that as well as some of the other forensic education programs that we're developing currently.
Great. Well, I'm sorry. We probably should just always do the who is here today because it sometimes helps to know, what role are folks having? Because I'll just say in my sort of social work and behavioral health career, lots of times when this interfaced, and I feel like a lot of things you're tasked as a case manager to learn a lot about a lot of things, and forensic stuff is just one of those circular spiral. You keep learning more, and then the laws change, and then you have a person you're working with that goes through a certain situation, and you suddenly learn a lot about that. The forensics unit at Western State Hospital very different from the civil side, and things don't work the same. And but I guess I would say, just as a practitioner and former sort of manager, just really finding those allies in the field where you find them. So locally, we would always work with what are called now the designated crisis responders, and have them come to our trainings at our agency. Make some good relationships with folks that can help you understand that when you're looking at civil commitment, this is not just a therapeutic tool, this is a legal tool. And that really always rang true for me, that, oh, this is, like, but this person needs help. Like, yes, but we're meeting different thresholds now. And there are also implications. And I think just not ignoring the trauma of going through something like getting your rights taken away. And we can sometimes just jump to that quick. So it's a long time of learning, but I think it's really helpful to just know resources that are out there, and really appreciate your time. So we're just about wrapped up. So I'm going to share my screen and just again, thank you, Dr. Piel. Just let sure people know, as you already can tell, we were doing questions. So we got through that. Just want to make sure folks, come on. It doesn't want to move. There we go. Your feedback is so important. And so I know the eval link has been shared in the chat. So please let us know. It's really helpful to hear what was useful and predicting what might be better for future sessions or what worked well if we want to do this again. Please connect with us. You can find us on the web, social, email us. We have a newsletter. And then as Dr. Peel shared, there are 2 more coming up in the next 2 weeks. And you can also register for additional resources and training at our website, which is www.mhttcnetwork.org/Northwest. And again, thank you, Dr. Peel. Just really, really grateful. And I know it's a very well received webinar. So thank you very much. And we'll look forward to next time.
Thank you, everyone.
Bye, everybody.